Hello friends, as we were discussing about lymphatic questions on the lymph nodes, we were getting confused about this. I just created a short video to get it memorized. So first of all, let's go for the lymph node drainage of the male genitalia. So confusing questions are regarding this. I just try to draw a figure to concise it. So here you can see the green color is the scrotum, then tip of the glans is light blue, dark blue is the bulbous part of urethra, reddish is membranous part of urethra, then yellow is prostate, and pink is testis. So if you just try to remember, the scrotum is supposed to be the superficial part, most superficial scrotum, then glans, then bulbous urethra, membranous urethra. In this manner, the most superficial is going to the superficial inguinal lymph node, and superficial inguinus further got as horizontal and a vertical chain. Most superficial is horizontal only. Vertical chain is supposed to be most of the time little bit deeper part. So deeper lymph nodes has got vertical chain, and that too a cloquet group of lymph node is one of the deeper lymph node. Let's go for the glans penis. Glans is a skin is superficial. Glans is supposed to be covered inside the prepuce. So glans, membranous urethra, bulbous urethra and glans, anterior part of the urethra and glans, both they go to deeper group of lymph nodes. If you see membranous urethra, it is going to the internal iliac little bit deeper. So membranous, internal, bulbous urethra, glans penis going to the deep inguinal, scrotum is going into the superficial inguinal. So this is about the right side you have seen. And left side I have drawn a figure of testis. It is pink color. So testis is most deeper. Actually it is abdominal organ. It has descended, so it grows directly to the para-aortic group of lymph nodes. Now if you see the prostate is first going to the obturator, then to internal iliac lymph node. Then from there urinary bladder, the ureter is there. So ureter, the lower part of the ureter is going to the common iliac. Upper part of the ureter is directly going into the para-aortic group of lymph node. Compare it with the female genital organs. You see here, this is the uterus, fundus is yellow, body is in pink, cervix in green, upper 2/3 of vagina is green color, and lower 1/3 of vagina is blue color. Then lower down is labia minora and majora. So questions regarding blue color, lower 1/3 of vagina, labia minora and majora. All these are going into the superficial group of lymph nodes. You can see this is the superficial part, so going into superficial inguinal lymph node. All the lower limb, skin and everything, they are going into superficial. Whatever melanoma is there, any infection is there, trauma is there, superficial group of lymph nodes are enlarged. So you are palpating the superficial, that is along the inguinal ligament. Horizontal group or transverse group, it's like a superficial inguinal ligament. And one more interesting thing is that cornu of the uterus, it has got attachment with the round ligament. So this round ligament is coming down to the labium, so it is draining into the superficial inguinal. So that is the one part. So the green part is the little bit deeper. You see upper part of the 2/3 of vagina and the cervix. This is in the green color. It is going into, if you compare this, you compare it with the prostate or something like that. Prostate is going into obturator, then internal iliac lymph node. Some of the questions they are going through obturator. Here is obturator, from here obturator to internal iliac. So if the option is there obturator, you have to write obturator. If the option is there internal iliac or external iliac or presacral, upper 2/3 vagina or cervix has to go into deeper group, that is external or internal iliac, not into the superficial or deep. So upper 2/3 vagina or cervix always goes into the deeper lymph nodes. So superficial inguinal lymph node is only up to lower 1/3 of vagina. Then if you go for the body of uterus, it is still deeper, so it is directly going into the iliac group, common iliac group. Pink color is body of uterus, so it is going into the common iliac group. This part, common iliac. Now the deeper part, further deeper part is fundus given in the yellow color. Fundus and ovary at the same level, so both are given in the yellow color. They are going directly into the para-aortic. You can see here the testis is going into para-aortic. Similarly, ovary is going to para-aortic. Here you can see upper part of ureter is in para-aortic. So here even in females, upper part of ureter is in para-aortic. Now you can see the urethra. Bulbous urethra is going into the deeper inguinal. So any superficial labia minora, majora, lower vagina is going into superficial inguinal, and this is about the female genital organ. If you see, questions are about the anal canal, above and below dentate line. Below dentate line is again, it is developing from the ectoderm, so it is going into the superficial inguinal. Dentate line, above dentate line, it is going to the deeper, so there is no deep inguinal, it is directly going to the internal iliac or external iliac. So anywhere lymphatic drainage from the colon and everything, they are further going into the para-aortic. Common question is regarding cervical, this esophagus. See, it is divided into three parts: cervical part, thoracic part, and abdominal part. Cervical into cervical group and supraclavicular group. Thoracic part into paraesophageal or posterior mediastinal group. The questions about abdominal part, most of the answers is left gastric, and stomach drainage of the stomach is most of the answers are celiac. Another interesting question is asked regarding lymphatic drainage of the eyelid, lateral canthus and medial canthus. Lateral canthus is going towards the tragus of the ear, preauricular, and medial canthus is going to submandibular. Next question, most of the commonly asked thing is about the lymphatic drainage of tongue. So I had divided and made a simple picture in this. Tongue is divided into 1, 2, 3, 4 halves. So anterior, the tip is directly going into the submental. Then remaining part, anterior, middle, and posterior part. Anterior part is further divided into two halves. Right side is going to right submandibular, left side is going to left submandibular. Then middle part is having crisscross. Middle part is draining into the both sides submandibular. So this is crisscross. Then posterior part is directly draining into deep cervical. Ultimately submental, submandibular, and they go into the deep cervical. So even if you see in this question, you can see the tip is going to submental. Here is the red color is submental, violet color is submandibular, and green color is deep cervical. Then they all go into the deep cervical. So question, if posterior tongue is there, it is deep cervical, tip of the tongue is submental, and middle part of the tongue is submandibular. And interesting part about the breast is there, it has got 3 levels of lymph nodes. Pectoralis minor is dividing lower, middle, and apical. So behind pectoralis minor is the level 2. Below pectoralis minor lower border, there are group of lymph nodes which are as per the boundaries of axilla: anterior, posterior, lateral, and medial. So first it is draining to the anterior group or pectoral group. So pectoral group is further going into lateral, posterior, intermediate group. Then they are going into the deeper group, central group. Then it is going to the apical part. So most of the questions are regarding lymph nodes about first group. Whatever it is there, level 1, 2, 3. The first group, if sentinel is the option, that will be the first drainage. Second question is regarding left supraclavicular. It is called virtuous lymph node. Then Cloquet's is in the femoral canal, and lymph node in the cystic triangle is the lymph node of Land is there. So this was in short. I tried to cover. Actually pictures is not possible. You can post the pictures to remember the lymph nodes. So these are the confusing lymph nodes. If there is some query, we can further discuss on this. Thank you.